Thank you, everyone, for joining us. Now, as you can imagine, the fact that I am speaking to you at 5:30 p.m. on the Saturday before Christmas, having just chaired an emergency meeting of my cabinet and spoken to the leaders of the opposition parties, suggests a serious situation, and it also suggests a situation that necessitates action. The information that I and my cabinet have received today about the new variant of the COVID virus that has been identified in the UK suggests to me that we do now face a very serious situation. It is, in fact, probably the most serious and potentially dangerous juncture we have faced since the start of the COVID pandemic in February and March. And that means we have to take this seriously, and it means that we have to act accordingly and appropriately. Now, the upside, although I appreciate that given what I am about to set out to you, it may seem inappropriate to be talking about upsides. But the upside is that if we do act now, and if we act firmly now, we can prevent that serious situation materialising. And the advantage that we have in Scotland, unlike some other parts of the UK right now, is that we still do have the chance to act on a preventative basis. So I want to set out clearly to you today what for Scotland the current situation is. I will also set out why, in light of an assessment of that situation, I consider that very firm preventative action is now necessary. And I will outline to you the action that the Cabinet has agreed this afternoon to take. Now, as I set out in Parliament earlier this week, COVID cases in Scotland had been falling in recent weeks as a result of the tough restrictions that everybody has been living under. But in the most recent week, those cases had started to rise again in parts of the country. It was as a result of that a number of local authorities were put into tighter level 3 restrictions, and that took effect yesterday. And a number of others, a larger number of others, were required to stay in level 3 restrictions. However, notwithstanding that, it is also the case that the situation in Scotland right now, at this moment in time, is not as severe as it is in other parts of the UK. Cases per 100,000 of the population in Scotland are around half the number that we currently see in England, and around a third of the numbers being experienced in Wales. And our statistics today, which of course were published earlier on this afternoon, 572 new cases representing 4% of all tests carried out yesterday, suggests a broadly stable position. So all things being equal, while we had no room for complacency, we had hoped that we might get through the next few weeks, at least in many parts of the country, without significantly more severe restrictions being necessary. Unfortunately, as is so often the case with this virus, all things are not proving to be equal. Last week it was confirmed that a new variant of the virus had been identified in the UK, and on Tuesday I advised Parliament that a small number of cases of that new strain had already been identified in Scotland. Now, over last night and today, the governments of the 4 nations across the UK have received further scientific briefing on the impact of this new strain. The UK Chief Scientific Advisor updated a 4 nations meeting that I participated in this morning, and the Chief Medical Officer, who you'll hear from shortly, has updated the Scottish Government Cabinet this afternoon. Now, firstly, it's very important for me to be clear that at this stage, there is no evidence to suggest that this new strain of the virus causes more severe illness. And there is no evidence at this stage to suggest that the new strain will affect the effectiveness of the vaccines that are being developed, or indeed the vaccine that is currently in use in Scotland. And all of that is reassuring, although further analysis is underway. However, there is strong evidence now that the new strain is spreading substantially and significantly more quickly than the strains of the virus that we have been dealing with up to now. And that evidence suggests that it could be up to 70% more transmissible than previous strains of the virus. And it may increase the R number by up to 0.4. Now, it is believed that this faster transmission may be driving the rapidly deteriorating situation in the south of England, including London and in Wales, where we already see cases rising quickly and hospitals under very severe and growing pressure. Now, we do not yet know how widely this new strain of the virus is circulating in Scotland. The latest information is that 17 cases have been identified in Scotland through genomic sequencing. But I think we have to be realistic that that is likely to be an understatement of its true prevalence right now. So all of that tells us that the strain, albeit that it may still be at lower levels than in some other parts of the UK, is present here already in Scotland, and therefore it does pose a real risk to us if we do not act and act firmly. And while further analysis is required to establish this one way or another, we do already have a concern that this strain may be driving what appears to us already to be faster transmission of COVID in some hospitals and also in some care homes. So given that this strain is circulating, we know widely already in some parts of the UK, and given that we know it is already seeded in Scotland and is already circulating, albeit perhaps at a lower level in Scotland, the bottom line we face right now is this. If we don't act firmly and decisively now to stop it transmitting, it will take hold here. And if that happens, the very serious and the rapidly worsening situation that we see unfolding now in Wales, in London and in the southeast of England will develop here too. And that would mean many more people getting COVID in the weeks ahead, and it would mean that by January our NHS could potentially be overwhelmed, which of course we have managed to avoid at every stage so far of the pandemic. And if all of that happened, it would mean many more people dying from this virus than would otherwise be the case. Now, to those who will understandably look at our case levels right now in Scotland and say, this action is not justified because our current case levels are relatively low, I would say this. 4 weeks ago, London's cases were very low too, and now they are running out of control. And that is what we face, unfortunately, if in the face of this very severe warning we have been giving today, we do nothing. And that is why the Cabinet has decided today that further action is necessary and that action requires to be firm. It is true to say that this action is not solely in response to the severity of our current situation, nor even is it simply a worry about greater interaction over the Christmas period in and of itself. It is very firmly action designed to prevent things getting worse, potentially very quickly getting worse as a result of this new strain. And I know that accepting greater restrictions on this basis, not as a result of what is happening in the here and now, but to stop a situation deteriorating, is hard for people to accept. I really understand that. But the most important thing we have learned through this pandemic is that failing to act quickly, decisively and preventatively in the face of this virus is always a mistake. If I could have my time all over again, I would act more quickly in February and in early March. And it's important that we do take the warning we are being given now very seriously and make sure our actions are appropriate in the face of that. So my judgment is that if we do nothing now or do too little now, knowing what we now know about this new strain, things will get worse and be much worse than they need to be. But if we do act now, we have a chance of keeping the situation under control while the vaccination programme continues to make progress and get case numbers back to very low levels again. So that's why we have decided to act and to act firmly. Now, the action we propose and that I'm about to set out is designed to do two things, and both of these things are important. Firstly, the action is designed to prevent more of this new strain entering Scotland from parts of the UK where we know it is already circulating more widely. And second, given that we know it is already present in Scotland, albeit we think in lower numbers right now, this action is designed to reduce the risk of it spreading any further here within Scotland. So let me set out what the Cabinet has decided. Firstly, we are asking everyone to redouble your personal efforts in sticking to the rules and following facts. That may sound obvious, but it is really important. That means staying out of each other's houses. It means abiding by travel restrictions. It means keeping a safe distance from people in other households, and it means following all of the hygiene advice really, really strictly. If you have been letting your guard down, which, given what we have all lived under now for so long, might be understandable, please lift your guard again. It is as important now as it was back in February and March that we follow all of that advice very, very strictly. Secondly, in order to reduce the risk of more of this strain being imported into Scotland, we intend to maintain a strict travel ban between Scotland and the rest of the UK. Unfortunately, and I am genuinely sorry about this, that ban will remain in place right throughout the festive period. We simply cannot risk more of this new strain entering the country if we can possibly avoid it. That means people from Scotland not visiting other parts of the UK and vice versa. Cross-border travel for all but the most essential purposes is not permitted. We're also asking Police Scotland and transport operators to consider how the enforcement of this can be strengthened in the period ahead, though of course how that is done is an operational matter for the Chief Constable. We'll also be reviewing urgently over the next day or so the position on international travel, and I will update on that early next week. But in the meantime, my strong advice continues to be against non-essential foreign travel. Thirdly, we have already advised that where possible, people should celebrate Christmas at home in their own household and meet with others outdoors only. The 5-day flexibility from the 23rd to the 27th of December was planned to recognise the impact of loneliness and the difficulty I know we all feel in leaving loved ones alone over Christmas. However, earlier this week we advised that people should meet indoors with other households, if at all, on no more than one day over the 5-day period. Given the concern we now have about this new strain, we now intend to change the law to allow indoor mixing in a bubble on Christmas Day only, from midnight or a minute past midnight on Christmas Day to midnight going into Boxing Day. In large parts of England, as the Prime Minister has just announced, that will not even be allowed. We will allow Christmas Day to go ahead, but as we have said from the start, only use this flexibility if you really, truly need to. This new strain makes that message all the more important. Our advice is still not to meet indoors, even on Christmas Day with other households, if you can possibly avoid it. If you had people travelling to join you for Christmas from elsewhere in the UK, that will no longer be permitted. Equally, it will no longer be permitted for any of us to travel to anywhere in the rest of the UK for Christmas. We simply cannot take the risk of this strain travelling from different parts of the UK. If you decide to travel within Scotland, that will be allowed on Christmas Day only. If you can't make it there and back on the same day, please don't go. And we're asking you not even to do that unless you feel there is genuinely no alternative. Finally, on Christmas Day, the household limits will still apply as we had set out for the 5-day period. A maximum of 8 people from 3 households will be the law. But again, our advice will be to minimise those numbers as much as possible. Standing here saying this, actually it makes me want to cry, as I'm sure listening to it will make many of you want to cry, because I know how harsh this sounds. I know how unfair it is, but this virus is unfair. It doesn't care about Christmas. It doesn't care about anything other than spreading itself as far and wide as possible. And it has just become, unfortunately, a lot better at doing that. Now, one other point I want to make, if you have caring responsibilities, you can, as has always been the case, still visit somebody else and travel to do that on any day if it is essential to provide care or assistance to a vulnerable person. That will not change. But for everyone else, my message is, please stay home and stay safe this Christmas. That is in your own interests and in the interests of everybody you love. Now, beyond Christmas, because of this new strain, we also need to make some changes, and this is my 4th point today. To limit as far as we can the risk of this strain spreading further than it has within Scotland, we intend to apply level 4 measures to all of mainland Scotland for a period of 3 weeks from 1 minute after midnight on Boxing Day morning. The exceptions to that will be Orkney, Shetland and the Western Isles and the other island communities where we have reduced restrictions in recent weeks. These areas will go to level 3 with strict restrictions on who can travel to and from them. All of these levels will be reviewed after 2 weeks. To be clear, that means that from Boxing Day morning, so this includes Boxing Day, non-essential shops will close, as will pubs, cafes and restaurants. Takeaway food will continue to be allowed. Finally, since the summer, we have been determined to keep schools open, and that remains our determination as far as we possibly can. And we've asked people, adults, to bear a greater burden of restrictions so that we can afford to keep pupils in our classrooms. The situation of this new strain, though, means that until we are sure we have that firmly under control, until we are sure that we are not facing the same situation as in the south of England or Wales, we must slightly change our plans for how schools will operate after the Christmas period. Schools will still open next week and will close on schedule as previously planned. We are not changing that. They were then due to reopen from the 5th of January with all council areas back by the 7th of January. Instead of that, here is what we are now going to do. For the children of key workers, nurses in our hospitals, for example, schools will open and stay open as previously scheduled. They will also open as normal for the most vulnerable children. All teachers will also return to work as scheduled and as planned. However, for the majority of pupils, the holiday period will be extended until the 11th of January, and starting on that date, learning will be online until at least the 18th of January. After that, assuming we are confident we have the virus under control, we will aim to reopen schools fully, but at least until the 18th of January, schools will go online only, other than for the children of key workers and the most vulnerable. Thank you for bearing with me. I'm going to ask the Chief Medical Officer and the National Clinical Director to say a word or two after me. But I've taken a bit of time to set all of this out because I know how difficult this is, and that's where I want to conclude. I know this is difficult because it's Christmas. I know it's difficult because it is involving greater restrictions for a period after Christmas. And I know it is also difficult because right now, as of now, our case numbers look as if they are not as bad as elsewhere. And therefore, I understand that people will be thinking, is this necessary? Please believe me when I tell you, with every fibre of my being, I would not be standing here on the Saturday before Christmas announcing this if I did not think this was necessary. I have spent, as all of you have, many anxious and worried days over the course of the past 10 months. But I've rarely felt more worried since much earlier in the year as I have today. If we don't act now firmly and decisively, this new strain is transmitting so quickly that it will very quickly overwhelm us. I want to do everything I can to reduce that possibility, and that is why these very difficult but very necessary measures are being outlined today. I briefed the leaders of the opposition parties earlier on. I will set out to Parliament as and when the presiding officer thinks that is necessary, but I didn't want to leave any time before setting out to you, the public, what these plans are, particularly given the proximity to Christmas. I know how difficult a Christmas this was always going to be, but now in particular it will be even more difficult. I am genuinely sorry about that, but we must take care collectively to stop this virus overwhelming us, to keep ourselves and our loved ones safe and stop people dying unnecessarily. And therefore I ask you to bear with us as we try to navigate our way through this next difficult stage of this pandemic. My final point is this. I've said a couple of times in recent weeks that there is a light. In fact, I've said many times in recent weeks that there is a light at the end of the tunnel. There is a light at the end of the tunnel. It has not gone out. The vaccination programme will pick up pace as we go into January. But I've also said that there will be times, because we are still in this pandemic, where the light will be difficult to see. That's the stage we are at right now. We can't see the light at the moment. It's obscured because of this difficult phase, but it hasn't gone out. It is still there. We do have brighter times ahead, but in order to get us safely, or as safely as possible, to those brighter times, I need to ask you for more sacrifices for a period. Thank you so much for listening. The Chief Medical Officer is going to say a few words, then the National Clinical Director, and then we are going to take some questions from journalists as normal.
Thanks, First Minister. So the UK is one of the most sophisticated programmes of genomic surveillance anywhere in the world for COVID-19. Between about 5 and 10% of all viral isolates in the UK are subjected to genomic sequencing, so we can learn more about the virus and the way that it behaves. And the UK accounts for about 120,000 of the known genomes of this virus that are available on the worldwide database. Since we learned about this new variant of the coronavirus on Monday, there's been a huge amount of work underway to understand its behaviours and its characteristics more clearly. NERTAG, which is the UK clinical committee that considers threats posed by viruses like SARS-CoV-2, considered the available evidence and data around this just yesterday. Now, viruses of all kinds mutate commonly. When those mutations occur, there are three broad considerations that need to be examined more closely. What does the mutation mean for transmission of the virus? What does the mutation mean for the severity of the disease associated with the virus? And what does the mutation mean for the pre-existing immunity, vaccine and treatments? Now, Jason will say a little bit more about the latter in a second, but I want to concentrate on the first two elements here. There is now moderate to high confidence in the evidence that this variant of coronavirus is associated with a higher degree of transmission. And as the First Minister says, that appears to be up to about a 70% increase in the transmissibility associated with this particular variant. In simple terms, it appears to be able to spread more easily than the virus that we've become used to over the last 10 months. There's been a very rapid rise in these cases in the southeast of England and in London, where this variant has now become the dominant strain. It appears to have seeded widely beyond this concentration of cases in the south of England, so that it's also been detected in smaller numbers elsewhere in England and the rest of the UK nations too. It's plausible and perhaps likely that this variant has contributed to this rapid rise in cases being seen across the southern part of England just now. At present, there is no evidence of change in the pattern of disease or the symptoms that are associated with this variant of the virus. It doesn't appear to lead to more severe disease, and it doesn't appear to be associated with a higher mortality. However, it's still very early in the analysis of this, and further work will continue to assess the impact on those who are infected by this variant over the coming days and weeks. The UK CMOs have alerted the WHO to this mutation. Scientists will continue to make further analysis of it to learn more about its behaviours and characteristics. In the meantime, it is more vital than ever that the public take steps to limit transmission in their area, to follow the advice and to continue to use facts to reduce their own chances of becoming infected at any time. Jason.
Thank you, Gregor. So there are three fundamental clinical considerations as a result of the science that Gregor has just outlined: vaccination, testing and treatment. The virus is presently being grown and tested at the Portadown facility in England for all of the UK countries to help us understand exactly what is going on. We know that this particular strain has 20 new mutations within it. The virus has changed, but our fundamental methods of fighting back have stayed the same. We need much more work, but as of December the 19th, for now, the vaccination works, the test works, and our limited treatments for those with severe illness work. But the most important fact is that your behaviour works. The way you protect yourself and your loved ones hasn't changed. Everything we know about infectious disease is that prevention is always the right answer. Every time you leave home, act as if you are infectious and act as if you have this new variant that transmits more easily. Wear a face covering, avoid crowds, clean your hands and surfaces regularly, keep distanced and self-isolate if you have symptoms. First Minister.
Thanks, Gregor and Jason. We'll move now to questions from journalists. I know many will be on tight deadlines, so we'll go through them as quickly as possible. Glenn Campbell from the BBC.
First Minister, you were never keen on easing restrictions over the Christmas period. With hindsight, do you wish you hadn't bothered?
No, I mean, I've always agonised over this, and you know that from the moment we announced relaxations, for all the reasons we set out, I've advised against using them unless absolutely essential, because in my view, they were only ever there in recognition of the fact that some people would find it impossible to leave loved ones alone. If it wasn't for what I've been told today about this new strain, I would not be standing here changing from what I said earlier in the week when we refreshed the guidance and tightened the guidance. It is this new strain that says to me we cannot afford to have that degree of relaxation, even if we're advising people against it. That is why we are reducing any ability to meet indoors with people in another household to Christmas Day only. But my advice, just as it was earlier in the week, is think even if that is necessary. If you can get through this Christmas in your own home with your own household, that is the safest thing to do. And that is my very strong advice as far as possible. And if you do meet with others for Christmas Day, try and do it outdoors rather than indoors. What we face right now is a really significant threat, and we have to act appropriately and accordingly. Ryan Marr from STV.
Thank you, First Minister. We are only days away from what was meant to be the start of the relaxation period, and with many people already having booked their travel from around the UK to come back to Scotland. First of all, how willing do you believe people will be in adhering to these new guidelines, and what would you say to those that may be thinking of still breaking these restrictions?
Thanks, Ryan. The travel restrictions that will be in place over the course of the Christmas period, just as they are generally right now, will be in law. They're not guidelines, they are the law. So the law will say that throughout this period, it is not permitted to travel from Scotland to the rest of the UK or vice versa. And that is harsh, and I recognise that, but it is necessary. And similarly, the travel restrictions that apply in Scotland right now, not to travel in and out of, if you live in a level 3 area, not to leave your own local authority area, and if you live elsewhere in Scotland, not to travel into a local authority area, apart from on Christmas Day, when you will be allowed to travel if you think it necessary, but only within that 24-hour period. Apart from that, these travel restrictions will stay in place, and of course, the vast majority of the country from Saturday will be in level 4, and therefore it will not be permitted to travel in and out of your own local authority area if you are in the level 4 area, and the other parts of the country will be in level 3. So for the next 3 weeks after Boxing Day, these travel restrictions that are in law will be pretty severe, because we think that is necessary to limit the spread of this virus generally, but in particular this new strain of it. Jim Matthews from Sky.
Thanks very much, First Minister. Can you expand on what you had to say about this new strain of the virus in hospitals and in care homes? And let me ask you about, it's often held up as the example that we speak about when it comes to Christmas and reuniting families. The grandmother or grandfather living alone, separated from their loved ones. Their presents will be bought, their travel plans might already be made. What do you say to them when they think, well, I'm committed, I'm going to do it, whatever I hear today from our First Minister? And what do you say to them, and what will happen to them if they make that journey?
Thanks for that. I'm going to hand over to Gregor and Jason to expand on what I will say about care homes and hospitals. I'll very briefly address that, and I should say we require to do further analysis in order to be definitive one way or the other about what I'm about to say is actually the case. But one of the things, so there's two aspects to this. One of the things we have been puzzling over, if that's not too frivolous a word, actually stressing over in recent weeks, is the fact that we have many fewer care homes than we did earlier in the year that have outbreaks. But what we have been witnessing is a phenomenon that when a care home has an outbreak, it appears to be infecting more people within that care home than perhaps previously was the case. And we've been struggling to understand that. It may be that it is not this faster transmitting virus that is responsible, but of course this now does raise the question in our minds, is that the case? And there will be genomic sequencing work done to try to help us answer that question. On hospitals, we have seen over the past few days a rapidly deteriorating situation in the borders of Scotland, which seems to have started within Melrose Hospital. And so again, the question has been raised in our minds, is that a factor? Is this new strain a factor there in what appears to have been a rapidly developing nosocomial hospital infection? But Gregor and Jason will be able to give you perhaps a little bit more on that. My message to people who were planning to travel, obviously there is the ability fairly tight, within fairly tight limits to do that on Christmas Day. I'm advising not to unless you really feel it's essential. And my message to everybody is, firstly, I'm desperately sorry. It breaks my heart to be standing here saying these things, as I know there will be heartbroken people listening to this right now. But this is, I hope, once in a century pandemic that we just have to get through as safely as possible. And anybody who is thinking about mixing with another household, travelling to do that, you're putting yourself at risk and you're putting people you love at risk, and perhaps raising the prospect of having loved ones that are not still with us when we do get to the other side of this. And I know that's really hard, but that is what we are living in just now, and we have to, I think, really just hunker down and get through this as much as possible. I don't want to get all literature focused. I used a quote from Seamus Heaney, the Irish poet, in Parliament a couple of weeks ago, which is, if I'm getting it absolutely correctly, if we winter this one out, we can summer anywhere. And that's the spirit we should be trying to use to get through this right now. Obviously, the police will enforce travel restrictions that are in place. It is for the police to determine operationally how they do that. People can have fixed penalty notices if they are breaching travel restrictions, but I ask people to abide by them to keep themselves and their loved ones safe. Gregor.
So the UK CLOs and senior clinicians across the UK have been in fairly close contact over the last few days. We've been speaking at least a couple of times a day in relation to what we are finding out about this new variant. And one of the features that we are seeing in other parts of the UK is quite a strong signal coming as part of that nosocomial infection. So that may be in hospitals or it may be in other institutions such as care homes. One of the features that we've become concerned about is the rate of spread that we've seen in some of the institutions in Scotland. And so I mentioned the genomic sequencing at the start of my statement. One of the things that we can do is to be able to take isolates of the virus from those facilities and subject them to genomic sequencing to see if there is any links back to this particular variant that might explain why the virus has, or why the infection has reacted in such a strong way in some of these environments. Jason, you might want to say a little bit more about the border situation. Or?
Yeah, so in NHS borders, we were concerned. In the main, around the whole of the UK, the healthcare-associated infections have followed community transmission rates. That's how it's worked, up or down. There appears to be something that has happened in borders that seems to step beyond that, beyond the community transmission. That may just be random, but we want to check. It's important for the public to realise, though, genomic sequencing is not quick. It doesn't help us in real time. It helps us, unfortunately, only retrospectively, because it takes quite a lot of time in the laboratory. So we will find out, but it doesn't help us today. What helps us today is people restricting their behaviour.
Thank you very much, First Minister. First of all, just on that quote, if we winter now, we can summer anywhere. For a long time, people in Scotland have been hearing this same thing. If we sacrifice now, things will pick up. And there was a lot of focus on act now to save Christmas. And I just wonder if, first of all, what you can tell those people who are starting to really, really feel demoralised that it's just one thing after another, and that lockdowns are not working. We don't have a lid on this through lockdowns. The second question is about obviously this strain that you're talking about is extremely concerning. Why then are we not locking down immediately? Schools only have 2, maybe 3 days left before they're going to close down anyway. That's a lot of mixing, a lot of kids going back to see grandparents on Christmas Day.
What can I say to people who are feeling demoralised? I don't expect this to make anybody feel better, but I share that. I'm not apart from this. I'm having to take these horrible decisions and announce them to you, but I am impacted by them as well. I share that sense of fatigue and demoralisation about this. We're living through a global pandemic. The only other thing I would say, and I don't expect it to make people feel better immediately, is that we're not alone. We're not alone in the UK, and we're not alone across Europe. You see countries, France, Germany, the Netherlands, many other countries right now have, ahead of us, imposed further really strict lockdowns because they understand, as we do, that we cannot allow this virus just to run rampant and take control of us. In terms of lockdowns are not working, I don't want us to be in lockdown, and we have actually avoided another national lockdown up until now, although much of the country will be in level 4 again come Saturday. But I would say, and this is perhaps a little bit different in Scotland to is in some parts of England, not all of England, and some parts of Wales, if it wasn't for this new strain, I wouldn't be standing here right now announcing this, because our case levels right now, because of the levels approach we've taken, are actually quite stable. This is preventative action because we know there is a more rapidly transmitting strain out there, and so we're acting preventatively. And everything we've learned about this virus says that you do that. You act quickly and don't have regrets later, and that's what we're seeking to do. But the second question is, why not just right now? And that is because this is preventative in Scotland. We're not in that really difficult situation that London is just now, so we can take this on not a slow basis, but a slightly more phased basis over the next few days. What has been announced by the Prime Minister for the south of England, what I know Mark Drakeford has been announced for Wales, these are parts of the country that already have case levels much, much higher than we have right now. So although we have to act quickly and decisively, we are still trying to be as proportionate as we possibly can. It's never an easy balance to get right, but we are seeking to do that as carefully as we can. Lewis Warner from ITV Border.
Thank you, First Minister. All of Scotland has been told to follow the rules and suppress the virus, get infections down. That has happened here in Dumfries and Galloway. The area just over a week ago moved into level 1. It has a rate of infection of 27.5 per 100,000. Jumping to tier 4, level 4 restrictions is going to be an extremely bitter pill to swallow after everybody's worked so hard to get things down to level 1. What would you say to people who think, well, the level system just isn't working then?
I can appreciate why people might think that, but that is not the case. This is not action that has been taken based on what Dumfries and Galloway's cases are right now. This is action that has been taken because we know that there is a faster transmitting strain coming at us, and we have to act to stop it taking a grip. It's preventative action. And I know that asking people to do things preventatively rather than do things that are responding to a current situation feels much harder. But it is really necessary to stop this deteriorating. And to people in Dumfries and Galloway, I would also say, take a look at Borders right now, which came down to level 1 at the same time as Dumfries and Galloway and is already going fast in the wrong direction. And we don't know, but we think that this new strain may be playing a part in that. So this is a development in this virus that I didn't, want to see, that none of us wanted to see. But the one thing we have learned about this virus is that when it decides to act unpredictably, we can't allow it to get away with that. We have to act in response to stop it doing the damage we know it will otherwise do.
Well, two quick pieces of data, perhaps. So if we are right, and Gregor's science that he's described is correct, then, and the R number is 0.4 more, you would have to be at 0.5 just now for this variant not to matter to you. Nobody is at 0.5. You can't get to 0.5. The country is somewhere between 0.9 and 1.1. So this variant would push us to 1.5. That's exponential growth and an overwhelmed National Health Service really quickly. On the 26th of November, London had a 100,000 rate of 155. 18 days later, it has a rate of 411. More than double, almost 3 times in 18 days. That's why you have to act fast and hard.
First Minister, what's the justification for allowing 8 people from 3 households to still meet indoors on Christmas Day, given you're advising people to avoid meeting indoors if at all possible? Why not cut it down to 2 households, for example? And also, shops are going to be busy in the run-up to Christmas as well. Do they need to increase safety measures such as reducing capacities in stores?
Look, we've limited any flexibility to Christmas Day alone, and we have decided to keep the numbers there. But please, please, please understand when I say that is a maximum. That is not what we're advising is okay to do. I said earlier in the week, and I would say it again, the smaller, if you have to meet indoors at all, avoid it if you can, but if you have to, that is now only permissible on Christmas Day, and keep the numbers as small as possible. 8 from 3 households is a maximum. But we've decided not to take that away completely, albeit we are limiting it to just 1 day rather than over 5 days. And your point about shops is a reasonable one. We would ask retail to, make sure that all of the mitigations are being properly applied, to think very carefully about their one-way systems, about the numbers they allow in shops, to think about capacity, to make sure that customers and staff are wearing face coverings, that they've got all of the right hygiene measures in place. That is important now. It will be important when non-essential retail reopens again, and those kind of measures are important in all places where people are continuing to interact. Tom Eden from PA.
Thank you, First Minister. Firstly, I just want to ask, if these are preventative measures, why is there that 1 week gap between Boxing Day and them coming into force? And with schools, you may have mentioned it earlier, I missed it, but with most schools finishing in a couple of days, would it not be worth closing the schools to pupils, giving teachers that time to prepare for the return of online learning?
Look, we've thought about this carefully. We think it is right to try to leave as much of what people were expecting in the immediate days in place as possible, and then to set out with as much notice as possible the changes we are making. In terms of the first part of your question, look, this is a balance. It's because this is purely preventative in Scotland that we've got a bit more space in order to act, whereas in parts of England and in Wales, the situation is already overwhelming. So we can do this not in a slow way, but in a slightly more managed way over the next few days. But that means between now and then, people have to redouble their efforts to follow all of the other guidance that's in place.
And we're not suggesting you can't behave as if you're in a level 4 just now. So if you don't have to see people, if you don't have to go to a store or hospitality, don't do it. Think carefully, like you have had to the whole way through this. So just because the law will start on Boxing Day doesn't mean you should reach the edge of the restrictions that you have in your place right now. Think carefully in the next 5 days as well as Boxing Day.
So this is redoubling our efforts here. We know there's a new external threat here which we face. This virus does spread much more easily. We're very fortunate just now in that we've only been able to identify a handful of cases across Scotland just now that it suggests it's here. What we want to do is to make sure that we keep that the case. The hard-won progress that we've made over the last few months, that we don't lose track of that. We can all play our part in doing that just by making sure that we redouble our efforts to ensure that we keep this new variant out of Scotland and that we limit the ability for it to be able to spread to other people within Scotland while we can too.
Gareth Rose from the Mail. Sorry, the Mail on Sunday, not the Sunday Mail.
Thank you, First Minister. You said that clearly you want a more robust approach to these rules, and the hows of that will be for the police. But can you give some indication of what people can expect in that, so that it's real for them? If you visit someone on Christmas Day, stay overnight, and were to travel back on Boxing Day, expect to be stopped, expect a fine. And just on the new variant as well, if possible, can you put into context, you said 17 cases likely to be an underestimate, certainly sounds like an underestimate. Is there any context you can give out how many cases there may be? And you've given some examples of where they may well be, such as the Borders General, but how widespread across Scotland do we think this might be now?
Gregor will answer that point, although the vast majority of the 17 identified cases, I think 16 of the 17 are in Greater Glasgow and Clyde. But we know with the virus generally, not everybody gets tested. And some people who will have been tested who have this strain will not have been genomically sequenced, so it is likely to be an underestimate. But Gregor will say a bit more about that. I'm not going to say any more about enforcement because it is for the police to decide operationally how they go about enforcement. We have said that we would like the police to consider how they enforce that in a way that makes it very obvious that people should not travel, but I am not going to step into the operational territory of the Chief Constable. What I would say to the public, though, is don't make your decision on whether to travel or not, or whether to breach these travel restrictions on the basis of whether you're likely to get caught or not. When you get into a car, you don't wear a seatbelt these days because you're worried the police will catch you not wearing a seatbelt. You wear a seatbelt because you know it's for your own safety. If something happens, it might save your life. The reason you should abide by these travel restrictions is the same, not because you might get caught breaching them, but because abiding by them will help protect you and protect people you love. And that's the rationale and the spirit that should guide all of our decisions right now.
Not every positive case is subject to the genomic sequencing which has identified this genetic variant that we've now been speaking about today. Probably across the UK, between 5 and 10% of all positive cases are sampled genetically to try to determine more information about them. So, and that's roughly equivalent to what we would do in Scotland as well. It's probably the most sophisticated programme, as I say, of any country across the world in terms of identifying the changes that may be occurring within this virus just now. What we can say, I think, with confidence is that of those 17 cases which have been identified, that is an underestimate of what the picture is likely to be in terms of real cases in Scotland, but we can't quantify that with accuracy at this moment in time till further work and analysis is done across the country. Those cases that we have identified have all been associated with the Central Belt at this moment in time. The majority of those have come from the Greater Glasgow region. We'll continue to do further work looking at the genetic samples that we have from all around Scotland to see if there are any of the case definitions that would suggest that this variant is to be found anywhere else in Scotland just now. That work will be ongoing, but there's a lag period in terms of when we determine that work. It's probably the work that has identified these cases in Scotland just now emanates from November, and will continue to find more cases, I suspect, as time goes by.
Mark Aitken from the Sunday Post. Mark Aitken, if Mark's not there, I'll move on. I'll come back.
Sorry, First Minister, can I ask, what's your recommendation for how long people can spend together on Christmas Day, please?
Is don't mix indoors and Christmas Day if you can avoid it. If you feel it is essential, the period where that is permitted is the 24-hour period of Christmas Day, but reduce the duration as much as possible. This virus, you're less likely to transmit it. The further apart from other people you stay, the shorter the duration of contact, the more ventilated the room is. So as few people as possible for as short a period as possible is my recommendation. Dan Vevers from the Sun.
Good evening, First Minister. Just on the phased return of schools, what are working parents meant to do in January? Should they take leave? And if the situation is not looking as dangerous come the start of January, could the online learning plan be scrapped? And what about nurseries? Can they open as normal in January? And secondly, is everything you've announced here tonight not just a final admission that test and protect, like test and trace, south of the border has failed?
No. What I've set out tonight is in response to a new strain of the virus that has been identified and is transmitting more quickly. It is no reflection on what was happening with the virus. In Scotland, actually, but for this new strain, I wouldn't be standing here right now because actually, I saw you tweeting earlier on today, actually, Dan, about the low level of cases in Scotland right now, which is a tribute to Test and Protect and how effectively it's working. So I think you're probably arguing the contrary to what you were tweeting earlier on. This is about this new strain and the risk we know it poses if we don't do something. We'll set out over tomorrow and into Monday detail of what I've set out today for schools, how that affects early learning. I know this will be really difficult for working parents, which is why we want to keep any period of blended learning to a minimum. And actually, one of the reasons why we are acting so firmly here is so that we will hopefully be able to continue to protect as soon as possible when we go into the new year, the ability of schools to be open as normal. Elsa Mishman from the Scotsman.
Thank you, First Minister. This new variant that we've spoken about is most prevalent in England and the southeast of England, but we've now got cases up here. We spoke here a few weeks ago about the second wave in Scotland being largely due to travel from everywhere, but from England especially. Does this new situation suggest that the border restrictions we've had in place recently are not effective enough? We spoke before about the lessons learned from that second wave. What lessons have been learned? You mentioned that Scotland has lower case rates than in the rest of the UK. What would you say to those who feel like Scotland is coming under tighter restrictions because of higher case rates elsewhere, and there's not being enough done to prevent those cases coming into Scotland. And just on a final point, the Health Secretary was asked yesterday whether or not a tighter lockdown would come in after Boxing Day, after Christmas, but she wouldn't be drawn on it. Was she not aware at that point about this lockdown, or was it a choice not to make that public?
I think if you've been listening to me, no, she wasn't aware, because Cabinet has only decided it in the last couple of hours, following a briefing that started last night with the Chief Medical Officer pretty late last night. I had a call with the Chief Medical Officer where he gave me the readout of a Four Nations Chief Medical Officer call about what was emerging about this virus. We then got further briefing in a Four Nations meeting this morning, and then the Chief Medical Officer updated Cabinet this afternoon. So by definition, when the Health Secretary stood here yesterday, she didn't know that this was coming today, but she didn't rule it out, because we know that with this virus we can't rule things out. But the chain of events that have led to me standing here right now kicked off pretty late last night. On your point about travel, look, I think travel restrictions are going to have to play an even bigger role in trying to protect us in the period ahead if we are to move out of January into a more open situation with our own society and economy. The fact that I think after just encouraging people to stick to facts and abide by the restrictions, the first thing I set out today was the importance of that travel ban between Scotland and the rest of the UK shows how important I think that is. And indeed, that is one of the things we have learned throughout the course of this pandemic. Travel bans come with their own costs and prices, so they're not easy to do and they're not easy to maintain, but they are a key part of our approach now and will continue to be, I think, for the next little while. Now, I am being told, I had a final question from the Sunday Times, John Boothman. I'm being given a signal he's not on the line, but I did see him on the video when we started here, so I'm just going to double check that John Boothman is definitely not there waiting to ask a question. Okay, in that case, John obviously decided not to, or no doubt had deadlines to meet. That concludes the questions today. Can I end by thanking the journalists for joining us at short notice? Can I sincerely thank Jill, our BSL interpreter, for stepping in at short notice to make sure that this briefing today, with the important information it contained, was accessible to people. Thanks to Gregor and Jason for not just their presence here, but their advice throughout this pandemic, and particularly over the past period. This is obviously a development none of us wanted to see, but for this development, I wouldn't be standing here right now, because the position we were in Scotland, while gave no cause for complacency, was relatively strong, and we had hoped to get through this next period without more severe restrictions. But we must act appropriately to the information that we've been given today. I am very, very sorry to everybody who will be in dismay at the idea of more restrictions, and particularly in dismay at the implications for Christmas. I wouldn't be standing here announcing this if it wasn't necessary. So please, please abide by these restrictions. Make sure you're abiding by facts. We will get through this next phase together, as we have got through all of this so far together. And don't forget that while we can't see it right now, that light is still there, because as we are living through this period, more and more and more people will be receiving the vaccine. And that is taking us ever closer to the point where we can look back on this pandemic and stop living through it. So thank you very much for all you're doing to try to help us get through this. I will see you again on Monday for a briefing, and we will update you then on the situation as we know it. But for now, thank you very much.